I am very privileged to be here with Dr. Jean Connors, who's a prominent hematologist at the AHA. Jean, thank you so much for your time. Would love to hear from you about the main studies that you found interesting during this AHA in Philadelphia.
Well, thanks, Behnood, and thanks, NATF. I'm delighted to give you my perspective, which may be different from a cardiologist, because after all, I'm a hematologist. But there are two big trials that I'm particularly interested in, and one area that I think we all agree needs further exploration. So the first is actually the ARIES trial, the HeartMate 3 trial, and full disclosure, I was on the steering committee. This trial took patients with HeartMate 3 and removed aspirin from their antithrombotic registry and found out that we did not lose efficacy, but we significantly decreased bleeding. That's a win-win for patients. Less pills, but also less bleeding. The second trial is the first factor 11 inhibitor that's really read out in patients who have atrial fibrillation with the use of factor 11 inhibition to prevent stroke. And in this trial, the abelacimab trial, led by Christian Ruff, the member of NATF, we found and we saw a significant reduction in bleeding. Again, like with the ARIES trial, no loss of efficacy with a factor 11 inhibitor at all, but definitely decreased bleeding compared to rivaroxaban at standard dose. This is huge because this really paves the way for improving the care of our patients. The last area, which I found intriguing because I'm not a cardiologist, is that having to do with the subclinical atrial fibrillation and longer duration of atrial fibrillation detected by implanted cardiac devices. Your AIDs, your loop recorders, and your pacemakers, where patients have potentially not very symptomatic or mildly symptomatic bouts of AF where there is an increased stroke risk. We saw two trials presented here today. One that compared anticoagulant to aspirin, the other compared anticoagulant to placebo. Increased bleeding, but I believe, as did Elaine Heilich, one of the discussants for one of the abstracts presented, that a risk of 1% of debilitating stroke is still significant. And so I think we need more traction in this area, perhaps with a factor 11 inhibitor. So thank you, Behnood, for inviting me to discuss my thoughts on AHA meeting so far.
Wow, that's wonderful. So it seems like we have accomplished a lot in reducing bleeding, and there is more to come for subclinical AF. Dr. Connors, thank you so much for your time and thoughts.
Thank you, Behnood.